I will be performing the vacuum tube method. Of course, I have used the two identifiers, the first and last name and date of birth of the patient. Also, I can also utilize their identification as well. Um, I will have the patient to sit with their arm well supported, slightly downward though. I have already assembled my equipment and my supplies. Now, I will sanitize my hands. I will apply the tourniquet around the patient's arm, as so, not too tightly. About 3 or 4 inches above the elbow. Then I'll ask the patient, I will locate the vein by palpating. Then I'll ask the patient to ball their hands in the fist. Thank you. Then I will select the site within the antecubical space right in here. Looks like I found one. That's good. I remove the tourniquet. I will clean the area with alcohol wipes. Starting from the center, work my way around in a circular motion. And then I'll wait till it dry while I assemble my equipment. Now I'll apply my gloves on. And I will apply the tourniquet back on the arm. I've already assembled my equipment and my supplies. Again, 3 or 4 inches from the elbow, not too tightly. And I've marked the area where the vein is being used. There we go. Now I will hold the assembly in my dominant hand. I will remove the safety cap from the needle. I will use my non-dominant hand and press down. As I already located the vein that I've selected, I will insert into the skin, into the vein, 10 to 15 degree angle, steadily. Excellent. I will apply the tubule as it feels. Keep that hand steady while I hold the dome from the top and my hand finger at the bottom to keep the needle steady. It looks like it's filled. Take it out gently, keep it steady. Add the other tube in. Steady again. Again, I have not moved the needle by no means. Now I'll remove the tourniquet because this is my last tube I have to fill. And once I have done that, I will shake it vertically about 5 times. And then this one is done 5 times as well. I will take my gauge, place it where the needle is inserted. Don't press down too hard and remove it steady as it went in. I will safety cap it, put it in the biohazard. Ask the patient to put pressure on there for me. While they're putting pressure on there, now I will label the tubes with the patient's name, date, time. If I have pre-printed labels, I'll do that as well and initial the bottom of the tube. And so I'll place it in the bag for transport to the laboratory. I will check the puncture site, make sure there is no bleeding or any hematoma formation. Then I'll apply the Band-Aid. As so. I will disinfect the area and dispose any blood contaminated materials into the biohazard waste container as so. Excellent. I'll dispose my gloves. And then of course, I have my laboratory coat on. I will remove that off take that off as well. And I will document it in the laboratory log, and that completes the process.